In this video, we're cutting through the confusion surrounding the different types of IV solutions, the 5 different categories they fall into, and why you'd prescribe each one of them. So let's dive in. So there are 5 main categories that all IV solutions will be defined as, which are hypotonic, hypertonic, and isotonic, and either crystalloid or colloid. These designations describe the tonicity of each solution. And once you understand fluid dynamics and tonicity, choosing an IV solution for your patient will become crystal clear. So now on to tonicity, osmolarity, and osmolality. So these are related concepts that describe the concentration of particles in solutions and how these particles affect fluid movement across a cell or blood vessel membrane. But while they're interconnected, they each focus on different aspects of fluid concentration and fluid dynamics. And these concepts play into how and why you'll select one IV fluid over the other for your patients. So let's break them down. First is tonicity, which refers to the ability of a solution to cause cells to either gain or lose water due to the differences in particle concentrations across a cell membrane. It specifically refers to the impact a solution will have on the shape and volume of a cell. So 3 categories of tonicity are hypotonic, isotonic, and hypertonic. And these are based on the concentration of a solution when compared to a reference solution, such as blood plasma. Next is osmolarity, which is a measure of the concentration of particles per unit volume of solution. And a unit volume can be a liter, it can be a fluid ounce, or it can be a quart. It refers to the total number of osmotically active particles in a solution, regardless of their size. So the fluid dynamic that comes into play here is osmosis. And this is a natural process, and this states that fluid always moves from an area of lower concentration to an area of higher concentration. And this happens passively, so there's no force applied here. The only thing needed for osmosis to occur is a semi-permeable membrane that allows for the passive exchange of water across it. So simple concept. Osmolarity is measured in osmoles or milliosmoles per liter of solution, which is written like this. An example of this, if you look at a bag of 0.9 normal saline, right here you see 308 milliosmoles per liter. So this is referring to the product's osmolarity. And then finally is osmolality with an L. Osmolality, not osmolarity. Okay. And this is a measure of the concentration of particles per unit weight, which is usually expressed in kilograms. It considers the mass of the particles in addition to the number of them. Osmolality creates oncotic pressure, and it lends itself to a more accurate assessment of the concentration of a solution. And like osmolarity, osmolality is also measured in osmoles, but per kilogram rather than liter. So to make this clear, let's compare all 3 concepts. So tonicity, osmolarity, and osmolality all pertain to the concentration of particles in a solution. But tonicity is influenced by osmolarity and osmolality. Tonicity describes the quality of a solution, whether they're hypotonic, isotonic, or hypertonic, while osmolality and osmolarity refer to the quantity and size of particles. So consider the size of a sodium molecule versus a protein molecule. The protein molecule has a much greater size and mass than the sodium does. So the larger the molecule, the stronger its oncotic pull. Just like gravity. The larger the planet, the stronger its gravitational pull. Same exact concept. So to clarify this even more, albumin is one of the most abundant plasma proteins in our body, but because it's part of the blood plasma, its function is to prevent leaking of water between the vascular space and the tissues. So just by virtue of its size and mass, the albumin molecule naturally holds water in the blood vessels. So this brings us to the final two major solution type designations you may hear in relation to IV fluids, which are crystalloid and colloid. So crystalloid denotes solutions that are made up of water and dissolved electrolytes such as sodium, chloride, potassium, etc. And they can also contain glucose or other smaller molecules. Crystalloid solutions function through osmosis, and you know these already as normal saline or dextrose or lactated ringer solution. In contrast, colloid solutions, or they're also called colloidal solutions, contain larger molecules, and examples of these are albumin, dextran, and hetastarch. And these are used as volume expanders because of the nature of their particles and how they affect tonicity. So think back to your chemistry and biology 101 days. Proteins are the largest molecules found in our bodies. Albumin is a protein. So colloidal solutions function through oncotic pressure, which again holds water in the vessels. So if you took a cell and you drop it in a cup of water that contains sugar, salt, maybe both, if the concentration of sugar and salt are different inside the cell versus the surrounding water in the cup, it will dictate what happens. Does it shrink the cell? Does it absorb a ton of water and blow up? Or does it do nothing because the sugar and salt are equal in both? So if fluid could make conscious decisions, it would always opt to dilute a concentrated solution. The body is always seeking balance between both the intracellular and extracellular fluid compartments. And the extracellular fluid compartment is further divided into two categories. The intravascular space, which denotes the space within our veins and arteries and consists of plasma, water, clotting factors, all the blood components. And then there's the interstitial space, which accounts for the fluid in our tissues and around our cells. This is also known as the third space. And at some point, you'll come across a patient that has unexplained weight gain, severe pitting edema, or low blood pressure, and here they're third spacing. And this is what it's referring to, an unexpected shift of fluid from inside their veins and arteries into the tissues. Now, in contrast, we then have the intracellular space, which contains the cytoplasm or the jelly-like substance that's a mixture of water, salts, and various organelles. Intracellular fluid is not to be confused with the cytoplasm. ICF is a subset of the cytoplasm and is the water in the cell where chemical reactions take place. So to understand how these solutions are categorized into each bucket, you need to keep in mind that normal blood osmolality ranges between 275 and 295 milliosmoles per kilogram. The benchmark for an isotonic IV solution is around 300 milliosmoles, with the range being between 252 to about 312 milliosmoles. So anything under that is hypotonic, and anything over that range is hypertonic. All right, so the first group of IV solutions we're talking about are the hypotonic IV solution group. These have a lower particle concentration than that of the body's intracellular fluid. So when they're infused, they'll dilute the plasma, the water will flow into the cell, which has a higher particle concentration and cause it to swell. And a lot of students remember this by associating hypotonic with hypotonic. So the osmolarity of hypotonic solutions, again, is less than 250 milliequivalents per liter. And these can be either crystalloid or colloid in nature. So hypertonic crystalloid solutions include 0.45 normal saline or half normal saline, 0.33 sodium chloride, 0.225% sodium chloride. So half-normal saline is the best for really fluid maintenance rather than aggressive intravascular volume repletion. A common scenario you'll use this in is when you have a patient who is hypovolemic, so they have low overall fluid volume because they have high sodium or hypernatremia in their extracellular fluid compartment, whether that's in the serum, within the vessels, or in the spaces between the cells and the tissues. So half-normal saline is used here because it dilutes the extracellular sodium, which is floating around in the blood vessels and tissues, and it encourages the movement of water back into the cells by osmosis because the sodium is higher within the cell versus the vascular space. 0.33 sodium chloride is used when someone is dehydrated but may also have some underlying renal issues. This solution allows for the kidneys to retain needed amounts of water. Other situations where you'll prescribe this is hypernatremia or high sodium, or the correction of hyponatremia or as a hyponatremia treatment. So in cases of severe hyponatremia, where fluid overload is a simultaneous concern, such as with cardiac or renal patients, 0.33 sodium chloride can be used to provide sodium in a slow and controlled manner while avoiding rapid fluid shifts so it doesn't overtax the heart or the kidneys but still corrects the issue. 0.225% sodium chloride is used for fluid maintenance in pediatric patients. This is the most hypotonic solution available and is normally given with dextrose to increase the tonicity. And then we come to D5W. Now, with any dextrose solution, it's really important to understand that this solution is technically isotonic. However, it acts as a hypotonic fluid because the glucose is metabolized quickly once it hits the circulatory system, and then it leaves only the water, which then makes it hypotonic. Next, we're moving on to hypertonic IV solutions. So hypertonic IV solutions are the exact opposite of what we just talked about. They contain higher particle concentration, so when they're infused, they pull fluid out of the cell, again, trying to create that balance. And solutions are considered hypertonic if the total particle content is equal to or more than 375 milliequivalents per liter. This effect causes cells to shrink and may disrupt their function and are known as volume expanders as they draw water out of the cells and into the vascular and interstitial spaces to normalize the particles between the two compartments. So these solutions include 3% sodium chloride used to treat severe, critical, and symptomatic hyponatremia or low sodium, 5% sodium chloride, which also treats severe low sodium cerebral edema and assists with diuresis, which is the process of removing excess fluids and waste product from the body through the urine. 5% dextrose and half-normal saline used to treat hypovolemia and as maintenance IV fluid. D5.9 normal saline again treats hypovolemia and is a maintenance IV fluid and provides calorie, water, and electrolyte. D5% in lactated ringers or D5LR provides calories, water, electrolytes, and also contains sodium lactate, which may be used to treat metabolic acidosis. Next, we come to 10% dextrose in water or D10W. And we also prefer to administer this solution through a central line, like a portacath or a PICC or a triple lumen catheter, due to the high potential of tissue damage and necrosis if the solution leaks into the tissues. And this is called extravasation. Now, this can occur if the IV is not properly in the vein and the fluid leaks out into the surrounding tissue. It is very painful, and in extreme cases, patients may experience compartment syndrome, peripheral nerve injury, skin burns, even amputation. 20% dextrose in water is next, and this acts as what we call an osmotic diuretic, which causes a strong fluid shift out of the cells and promotes diuresis. And then last is D50 or 50% dextrose and water. And this is administered via an IV bolus to treat patients with severe low blood sugar. And finally, there's isotonic IV solutions, and these don't push or pull fluid in or out of the cell. They're equal in both water and particle concentration to that of blood plasma. So this helps maintain cell shape, prevent cellular shrinking or swelling, and it provides effective hydration and fluid replacement. And these IV fluids will volume expand only, and they include 0.9 normal saline, which is like the plain white t-shirt of IV solutions. Recall that human plasma osmolarity is around 275 to 290. The 308 milliosmoles per liter that normal saline comes up with, you'll note is slightly above the normal osmolarity range for human plasma. But the tonicity of blood varies slightly from person to person, so normally 0.9 sodium chloride will work comfortably in all humans. It's the fluid of choice for resuscitation efforts when somebody has severe fluid loss due to hemorrhage. And you'll also see this used to treat metabolic acidosis and hypercalcemia or high calcium levels. The 0.9 means that there's 9 grams of salt per liter, and the solution is used for maintenance IV fluids in all pediatric patients greater than 1 month due to the risk of low serum sodium in kids with the use of hypotonic solutions. Lactated ringers is the first-line choice for fluid resuscitation in burn and trauma patients. This is also used to treat acute blood loss or hypovolemia due to third space shifting, GI loss and fistula drainage, electrolyte loss, and metabolic acidosis also round out the uses for this solution. Plasmalyte is an electrolyte composition that's so similar to plasma that it can actually be infused with packed red blood cells. It's less likely than other fluids to lead to dilutional or hyperkalemic acidosis. The cool thing about Plasmalyte is it's not associated with a disturbance of acid-base balance caused by the lactate that's in lactated ringers. All right, so now we're going to talk about colloidal solutions and how they're used. These solutions contain large molecules that do not pass through the cell or vessel membranes and therefore remain in the blood vessels. They are also known as volume or plasma expanders because they draw fluid from the interstitial space into the vessels through a higher oncotic pressure. So less volume of these solutions is required compared to regular crystalloid solutions to achieve the same hydration results. So remember, if a large protein molecule is sitting in the vascular space, it's going to hold water and draw more towards it because the larger the molecule, the greater the pull. So colloids are indicated for patients in malnourished states for moderate protein replacement and patients who cannot tolerate large infusions of fluid. These solutions include 5 and 25% albumin, which is used to increase volume and to restore protein levels after burns, pancreatitis, and plasma loss due to trauma. It's also considered a blood product, so you'll use the same protocols and precautions you do with other blood products when you're infusing them. It is the most widely used colloid today. And specific scenarios include cirrhosis and ascites. There's nephrotic syndrome, which is if the kidneys are leaking large amounts of protein, including albumin, into the urine, then this can lead to low albumin levels and altered oncotic pressure. During cardiopulmonary bypass, albumin may be used to prime the heart-lung machine to maintain colloid oncotic pressure during the procedure. Next, we come to low molecular weight dextran or dextran 40, which improves microcirculation and to prevent thromboembolism in certain surgical procedures or trauma. High molecular weight dextran or dextran 70 and dextran 75 helps with hypovolemia and hypotension. Next on this list is esterified starch or hetastarch or Voluven. And this is used to increase intravascular volume rapidly and comes in various concentrations and molecular sizes, which allows healthcare professionals to choose the most appropriate formulation for their patient's specific needs. Gelatin has a lower molecular weight than dextran, so it stays in the circulation longer and is used to volume expand and improve tissue perfusion. Now, given the nature of colloidal solutions, there are multiple concerns and precautions that need to be followed when you're prescribing or infusing them. And there's quite a bit more information and precautions that a prescriber needs to know to order all of these solutions safely and for optimal outcomes. There are also certain situations that you should never use a particular solution. So click here to find out what those are, and I will see you there. Stay healthy and lucid.